Okay, so we're going to be dealing now with chapter 5, which is an introduction to pathophysiology. Understanding pathophysiology. Now, basically, uh, pathophysiology is the study of the disease process that affects the function of the body itself. Knowing the body's signs and symptoms when things are wrong helps identify issues and provide prompt care. The cardiopulmonary system and perfusion. Okay. The constant supply and perfusion basically is the constant supply of oxygen and nutrients to the cells uh, by the flow of blood. And remember, the flow of blood, you have to have your, your heart, your blood vessels, and your fluid, which is your blood. Perfusion is all components of the cardiopulmonary system must actually be functioning. So the lungs have to function. Air has to get in. Air has to go all the way to the alveoli. And in the alveoli, it has to perfuse out through a process of called diffusion into the capillaries, which is now part of the cardiovascular system. And it has to be picked up by the red blood cells and their oxygen carrying capacity in the red blood cells and iron, which basically helps it, and then eventually get pumped around the body to its target organ. So all components of the cardiopulmonary system must actually be functioning. Oxygen delivered all the way to the alveoli and carbon dioxide transported out. So we breathe in oxygen and we breathe out carbon dioxide. Enough available blood, functioning pump, and enough pressure to make the exchange itself. Okay. Hypoperfusion, also known as shock, occurs when the perfusion fails. You had hypoperfusion, cells become hypoxic without perfusion of adequate oxygen. The switch to anaerobic metabolism, which is basically the cells working without oxygen, produces lactic acid and waste products which build up, and cells eventually die. Cells need constant supply of blood. The blood supply delivers oxygen, nutrients, removes waste products. You have a constant blood supply is known as perfusion, and perfusion relies on interrelations of cardiovascular and the respiratory system itself. Okay, let's see if I can find my little anything there. Disruption of fluid balance. You might actually have edema, which is basically swelling. Fluid trapped in the body's tissues from illness, hands, legs, and feet. Or you can actually have an injury which causes capillary leak, so you're losing blood internally or externally. The cardiopulmonary system, you have the cardiovascular and respiratory system work together. The respiratory system transfers oxygen to the bloodstream itself, and the cardiovascular system transports oxygen to the body cells, and it brings carbon dioxide back to the lungs for elimination. The respiratory system, the structures is the airway, lungs, and muscles of respiration. Remember, the main muscles of respiration are your diaphragm and your intercostal muscles. A patient's fluid balance can actually easily be assessed externally. Dry mucous membranes, sunken eyes, and tachycardia and low blood pressure can actually indicate dehydration. Edema in the ankles and feet can actually give an indication of poor fluid distribution. Aerobic versus anaerobic metabolism. Now, aerobic means with oxygen, anaerobic means without oxygen. That's why when you start working out, you do aerobic exercises and you utilize oxygen. Okay, metabolism, now aerobic versus, and anaerobic metabolisms. Metabolism comprises of chemical and physical processes necessary for maintaining life. Aerobic metabolism uses oxygen. Anaerobic metabolism doesn't use oxygen. It's basically is abnormal and is less efficient. Our body, now, how many of you guys actually work with cars or like working with cars? It's an art that's actually not that many people do. But you know that in your car, you have a carburetor that mixes up the outside air with the gasoline and it causes combustion, right? Well, our body doesn't use gasoline, but it uses sugar in the form of glucose and it mixes up with oxygen. Okay, and the process that it goes through is oxidative phosphorylation. And this oxidative phosphorylation basically causes our system to work. If you don't have enough oxygen, then it doesn't work. Like if you cover up the air intake to your car with a towel, it's gonna eventually turn off. Or if you run out of gasoline, your car's gonna turn off. It's the same thing with the human body. It needs glucose, blood, and oxygen from the outside to actually cause metabolism to occur. Again, the process is called oxidative, which means oxygen. Phosphorylation, it uses phosphorus to actually do the interchanges in your sodium, potassium, whatever. But when it doesn't use oxygen, it goes through a different process and it's not as efficient. Anaerobic metabolism causes the life-threatening, anaerobic metabolism causes life-threatening, I'm reading it wrong. I guess they didn't separate. It usually occurs during heart attacks and occurs during the loss of large amounts of blood. So we have this little structure in the cell called the mitochondria. And the mitochondria is the powerhouse of the body. And what happens is you get oxygen and it travels to the mitochondria where it mixes up with glucose and it causes the mitochondria to function and give energy. Now, the form of energy that we use is ATP, and ATP stands for adenosine triphosphate. Okay? When it comes to lactic acid, it doesn't do it, but it utilizes some of the chemicals that gets you produced pyruvic acid. And pyruvic acid eventually becomes lactic acid. And lactic acid, anything that's acidic in our body, not good. So, like when you guys start working, like, I don't know, I can't ask if you guys work out because sometimes you people do, some people do. But let's say you decide to go work out today and you're going to lift what you used to lift 10 years ago. And you start lifting as many times, as many hours, whatever. What's going to happen to your body? You're going to become sore. Okay. You guys can hear me, right? I just got something to tell me to check my mic.
Yes, sir. We can hear you.
Okay. So basically, at this point, if you start working out like excessively, well, you don't have the blood vessels, the blood vessels are not developed as much as they used to be. They atrophy themselves. And now what happens is that you develop soreness. And guess where that soreness comes from? The production of lactic acid. Okay. But the more you work out, the more blood vessels form, more oxygen gets to your muscles. Now, the respiratory system itself, when it comes to pathophysiology, the airway movement of air in and out of the chest requires patent airway. And by the word patent, it means an open airway. So patent and open means the same thing. Upper airway obstructions usually are above the trachea and prevent air from actually reaching the lower airway, which is your alveoli. can develop altered mental status, foreign bodies, and trauma, or can actually be caused by altered mental status, in which once you go unconscious, your tongue becomes real loose, and the most common airway obstruction in an unconscious patient is their tongue. So they have airway obstruction by the tongue, and you need to do what we call an airway maneuver. It's called the head tilt chin lift or the modified jaw thrust, and we'll teach you how to do those. The lower airway complications, you have bronchial constriction, which increases airway resistance and decreases the amount of air that actually reaches the alveoli. You can also have asthma that actually is about the same thing as bronchial constriction. The only thing is that one's caused by an infection, the other is caused by the body itself. Actually, it can actually be caused by a whole bunch of things. So ideally, what happens is that if you see this is your alveolar tree. Okay, and these little grape-like looking things are your alveoli. And outside your alveoli is a group of capillaries. And oxygen goes from right here to the capillaries, and carbon dioxide goes from the capillaries to the alveoli and get expelled out. Respiratory system, the lungs, you might actually have problems with your diaphragm, chest wall, or are responsible for pressure changes that stimulate breathing. You have tidal volume, which is the amount of air you can actually take in depending on your size, and also depends on your age. Respiratory system, lungs, dead air space is the amount of air that stays inside. So let's say if I ask you all, breathe as much as you can as you can out. Okay, eventually you cannot get rid of the dead space air because it keeps the tissues open. In other words, the bronchioles, the alveoli, and everything else. Now, if you get sucker punched and they knock the wind out of you, guess why you actually have a problem to breathe after that? Because all the lining of the airway is actually covered by mucus, and mucus is very sticky. So what happens is that if for whatever reason somebody sucker punches you, it causes the alveoli to collapse, no air is getting in there. So you have now you have to fight against the stickiness of the mucus and air trying to get in. Now we have a couple of different approaches. We can actually get a BVM, which is a bag valve mask, which is a little bag that you get to see, and you force air in there, and it causes the alveoli to expand. The other one is you can wait about a minute. The body releases a chemical called surfactant, and surfactant breaks down mucus. Okay, so then your airway can actually get opened up. So basically, this is about 150 mLs that stay within the lung tissues to keep them open, even if you're trying to force it all out. Okay, the respiratory system dysfunction, you have disruption in respiratory control. You can actually have damage to the medulla oblongata, which is basically one of the brain parts that controls respiration. It can actually be caused by stroke, tumors, an infection, toxins and drugs, or spinal cord injuries and diseases. Okay, disruption of pressure. If I have a kid, I want to call him medulla oblongata. He'll be very popular with that name. Hey, Med. Hey, Obli. Nah, maybe not. Okay, disruption of pressure. You have chest cavity in the closed container. And you have also the diaphragm, ribs, and intercostal muscles change the size of the cavity itself. So whenever the intercostals, or the muscles in between your ribs contract, they open up the chest. And when your diaphragm contracts, it straightens out. So your lungs become bigger and forces air from the outside to come back in. Respiratory system dysfunction. You have disruption of pressure. You have the lungs are attached to the chest wall by two different membranes. One's called the parietal pleura, which is the one that surrounds the cavity itself, and the visceral pleura. Visceral means organs. It covers the organ itself, and those stick to each other. Now, whenever you have like a stab wound or whatever, and you introduce a little bit of air in there, the lung collapses. So you need to watch out. You need to watch out for those. The pleural space may accumulate blood and air, and if it accumulates air, then you have a pneumothorax. Pneumo means air. If you accumulate blood, you have a hemothorax. Hemo means blood. Respiratory system dysfunction, disruption of pressure. You have expanded chest cavity creates negative pressure and lets air in. And this is by causing the intercostal muscles and the diaphragm to contract, which basically enlarges the chest wall, causing the lungs to expand, causing air to forcibly come in. A relaxed chest wall basically creates positive pressure and forces air out. So once you relax the muscles, air goes back out. Okay, a hole in the chest wall affects the changes in pressure themselves, and blood or air in the pleural space creates a hemothorax or a pneumothorax, which is two terms that I just went over. Hemo means blood in the lungs, and pneumo means air trapped in the lungs. Respiratory system dysfunction, disruption of lung tissue. You have damage to the lungs tissue, reduces ability of gas exchange, can actually be caused by trauma, pneumonia, infection, or reduced oxygen levels and increased carbon dioxide levels in the body. The brain monitors carbon dioxide levels in blood and increases or decreases respiratory rate in tidal volumes as needed. In the cardiovascular system, is comprised of blood. It transports systems, which is transported the system of the body itself, and in insufficient quantity leads to poor circulation. So if you don't have that much blood, then you have a hard time actually sending blood out to the system itself. The cardiovascular system, you have blood vessels are pathways. You have arteries, veins, arterioles, and capillaries. Arteries carries oxygen blood away from the heart. Veins brings it back to the heart. And it tells you carries the oxygenated blood to the heart itself. Arterioles feeds oxygen blood to the capillaries, and capillaries offload the oxygen and picks up carbon dioxide from the cells themselves. Blood vessels and pathways, you have pulmonary arteries, which basically carries deoxygenated blood from the heart to the lungs. You have the pulmonary veins, carries oxygen blood from the lungs to the heart itself. And then you have the blood pressure, which is created by the beating of the heart to move blood around the body itself. Blood pressure, you have the diameter of blood vessels, and volume of blood directly affects the amount of pressure that you're going to have. You have dilated blood vessels, you are going to have a low blood pressure, also known as hypotension. If you have constricted blood vessels, you have hypertension. Now, I need for you to understand this. When it comes to blood and blood pressure, I'm going to draw this. Imagine every time your ventricle contracts, it forms a ball of blood. Okay? Now, this ball of blood has to travel through blood vessels. And we have two different blood pressures. You have your systolic and your diastolic. Now, the pressure that this ball of blood is putting against the blood vessels right here is your systolic. The pressure, the blood vessel, the blood is traveling this way. The pressure that remains in the blood vessel after the gulp of blood goes through is your diastolic. Okay, and we'll get into more detail into that one, but you need to understand that that's what blood pressure is. The heart, the four-chamber pump designed to move blood, and the stroke volume is the volume of blood ejected from the heart in one contraction. Okay. Cardiac output is the amount of blood ejected from the heart in 1 minute. Increased heart rate leads to increased cardiac output. If rate is too fast, the output actually decreases, and it becomes like if it's above 180 beats per minute, it brings down your blood pressure. Okay, autonomic nervous system is responsible to adjust cardiac output. So you have your sympathetic fight or flight response or the parasympathetic response itself. Okay. Heart rate or heart failure. Electrical failure, you have tachycardia, bradycardia, or ventricular fibrillation. Oh, sorry, I didn't mean to move it. Mechanical failure can actually be caused by trauma, squeezing of the heart muscle, or loss of cardiac muscle due to cell death. Cardiovascular system compensation. In other words, how does the body try to regulate itself to compensate for any issues that might be occurring? The sympathetic nervous system compensates for hypoperfusion. Hypo meaning low. This word hypo means low. Perfusion is blood pressure. So what happens is that when you have hypoperfusion or low blood pressure, the vessels tend to constrict. The heart rate increases, pupils dilate, skin sweats, and the brain responds to increased levels of carbon dioxide. You have an increase in deeper respirations also. One of the leading causes in pediatric patients of death is issues with the respiratory system. Children compensate different than adults, and an increased heart rate is the main mechanism. Now, I'm going to draw this for you so you can understand. Let's see if you have a chart right here. Okay. Normal blood pressure should be from right here to right here. So if you start with an adult, they're going to get up there and they're going to maintain it. But all of a sudden they get shot and blood is actually escaping the body. They're going to drop slowly until the heart cannot maintain it anymore. And it's going to maintain the blood pressure at this section because you have constriction of blood vessels and you have an increase in heart rate. Now, I kind of remember where to get my colors. Hold on. In a kid, they're going to start off and eventually they're going to get to the same level to maintain blood pressure, but a kid doesn't have enough blood in the system. So let's say he gets shot and he starts losing blood, they drop drastically. Okay, so they die a lot faster. With adults, it tends to maintain a little bit longer. So you need to be wary about with kids that you can lose it from 1 second to the next. Pediatric compensation, vasoconstriction allows them to actually to maintain blood pressure with significant volume loss. Blood pressure is an unreliable factor during assessment in pediatrics because they can go down very fast. Higher metabolism rates burn off oxygen faster, which basically means that they need to get provided with oxygen. Recognizing now the system compensation, if you think about recognizing compensation, is an important element in the assessment of a patient because it can actually rapidly identify a patient in shock. EMRs should always be on the lookout to telltale signs of shock, such as an increased heart rate, decreased blood pressure, and abnormal respiratory rate. Okay, so when we're looking for, we're going to be going over vital signs. Key thing is that an increase in heart rate. What is normal? We need to go what normal heart rate is eventually, but an increase in heart rate and decreased blood pressure means shock. Any questions, guys? We're done with this chapter also.
No, sir.
Okay, so what I'm gonna do is I'm gonna go ahead and send you all the next assignments. I'm setting up, now that I kind of figure out who's gonna be in the class, I'm setting up what do you call it? The Google Classroom, so you can actually have more access to it. I did send over the link for YouTube for the video on Monday. Can you all check to see if you got it? I know some of you might have not gotten it because
Yes, sir, I got it.
I didn't have your emails yet.
I got it, sir.
Okay. If you click on it, it'll take you to the video so you can watch it. I just recorded this one, and you have access to this one also. Okay. So then I'll get to see you on Friday, and we'll cover the next couple of chapters. We are here at one chapter, so don't get freaked out. I'll send you the assignments anyway. So anyway, let me just again get the names of everybody because I'm gonna send everybody the same thing again. 1, 2, 3, 4, 5, 6. Okay. So Alejandro, Elian, Gustavo, Miguel, Luisa, and Norma. Okay, so what I'm gonna do is I'm gonna go ahead and email you. If you don't get it, feel free to give me a call or email me. Okay, just to make sure.
What are the hours that we can call you if we need anything?
Actually, if I'm awake, I'll answer the phone.
Okay.
Normally, if I don't answer, it's because I leave the phone charging, walk outside. But as soon as I get to see it, I'll give you guys a call back.
Okay, thank you.
Except for
Sir,
Mándeme.
the assignments from chapter 1, 2, and 3, how do we turn those in?
Okay, I'm gonna see if I can set the the Google Classroom, and I'm gonna start
Okay.
sending stuff to the Google Classroom also, and you can actually send them back. A lot of times, if you can usually, if you don't have a scanner, I don't remember if you could just put the answers on a separate piece of paper and just take a picture of it, you can send it back to me.
Okay. No, I
Okay.
did it I just highlighted the answer the correct answer.
Okay.
That's how I
Again,
did it.
if you don't have access to a scanner, then you can take a picture and just send it over to me. But wait till
Right.
I set up the Google Classroom. I was just waiting to get confirmation from Google Classroom and I'll send you the invites through there.
All right, sir. Thank you.
Okay, no problem.
All right,
Then I'll
thank
see you on Friday.